Hey everyone, we are super excited to be spreading awareness and destigmatizing mental health in the Black and Brown communities.
This podcast is a safe place for us to discuss our adversities and even our shortcomings. We all have a story.
Just remember, no matter what we go through, our story goes on. What's up everyone? Welcome back to Our Story Goes On. And we are on episode 10 of season 3. And I am very excited because usually we stop at episode 10. So season 1 and season 2, we stopped at episode 10. But your girl's still here and we're going to keep rolling. We're probably going to do... I don't know how many more we'll do, but we're not stopping at 10. So that's obviously a good thing. But I hope everyone is doing well. I am feeling good today, and it's always just a good vibe when I'm here, and I'm so grateful to be able to speak on these topics that I am passionate about. Of course, each topic is different, each episode is different. Last episode, we discussed suicide prevention, and, I wanted to get into a little bit more about like specifics when it came to mental health. And I say overall that our podcast is very much mental health and well-being, growth, all that. So, it's kind of good to get back into like the root of things sometimes. But yeah, I just hope that everyone is well. And you're having a good week, and, we're in September. I don't know where everybody else is at in terms of the country or globally, but New Jersey's weather is up and down. I feel like I thought we were seeing the fall weather, and then it's going to be like 85 degrees this weekend. So, but, it's, I love the fall so much. So I'm kind of like ready for it, but I also love the warm weather. So, but all right. So, today we're going to be talking about peripartum depression, otherwise known as postpartum depression. So I'm going to get into that right now in terms of the difference. And I don't think many people know that there is that term, the peripartum. I hope I'm pronouncing it right. It's spelled P-E-R-I partum. And so I say it peripartum. Peripartum? I think that's right. And so the difference between peripartum versus postpartum. Now, according to the DSM-5, and the DSM stands for Diagnostic Statistical Manual, and it's basically the Bible for us mental health professionals. It's basically this really big book of all the mental health disorders and conditions that you can think of. So we refer to that book when we are diagnosing a client with a specific disorder/condition. So according to the DSM-5, between 3 and 6% of women will experience onset of a major depressive episode during pregnancy or in the weeks or months following delivery. 50% of postpartum major depressive episodes actually begin prior to delivery, and thus these episodes are then referred to as peripartum episodes. So postpartum refers to a depressive episode that occurs within 4 weeks of delivery. So I hope that kind of made sense in terms of that breakdown. So the reason why people are trying to use more of the word peripartum, because most women who deliver babies have experienced a depressive episode prior to childbirth, and then they're now ongoing afterwards too, like the symptoms and everything, which we'll get into. And so postpartum is more about 4 weeks after delivery, right? So it's like the same thing when we were talking about post-traumatic stress disorder, right? So in order to be diagnosed with post-traumatic stress disorder, the person must have symptoms within a month after. They must still be presenting with symptoms 1 month after, right? So it's kind of like the same thing in the sense of the postpartum. And so that's kind of like the breakdown of the difference of them. They're still interchangeable. Like, it's not like they're trying to change the wording, or there's still an interchangeable term. It's just that I think we are trying to shed light more on the women who may have been feeling depressed or anxious prior to childbirth. And then that still kind of went into it as they became a new mother. So I hope that makes sense. So, what is peripartum slash postpartum depression? So, it is referring to a depression that occurs during pregnancy or after childbirth. So, it is a very serious but treatable mental health condition, and it involves feelings of extreme sadness, indifference, and or anxiety, changes in energy, changes in sleep, and appetite. And with that, it might mean in terms of a person overeating or undereating. And then the same thing when it comes to sleep. It could mean that a person is undersleeping, which means they're not getting enough sleep. They have trouble falling asleep or staying asleep. Or the opposite of it, as well as a person might be sleeping too much. And I know that might sound odd to some people because you're thinking, like, well, how can a person sleep too much when they've just had a baby? But the circumstances could be different in everyone's situation, right? So that's just to keep in mind. So the thing is that pregnancy and the period after delivery can be a very vulnerable time for women. And mothers can often experience immense biological, emotional, financial, and social changes during this time, which then can be an increased risk for developing mental health problems, particularly depression and anxiety. And I wanted to talk a little bit as well about the anxiety too, because I don't necessarily think that many people actually discuss anxiety more than as much as they do the depression. And of course, they can go hand in hand. It's not necessarily saying that, like, you can't have one or the other, because they overlap a lot. And it's just that a lot of times I've worked with clients who've experienced postpartum anxiety more than they've experienced actually the depression side of it. And that's not to say that they might not realize that some of their symptoms might also look like anxiety. And that's something that we discuss together, of course. But the anxiety aspect of it is actually very much real, just like the depression is as well. And the anxiety, I've heard, also can be, anxious about, especially I feel like as new moms probably too, right? I mean, like I said before, I'm not a mom, not yet. And, the anxiety, I think, especially of probably, am I taking care of the baby right? Is the baby crying too much? Should I take him or her to the hospital? Anything like that. So I think that's where the anxiety comes in. It's probably overthinking and overstimulating your brain with things that might not necessarily be rational in that moment. So now I've also worked with clients who have actually had postpartum or peripartum rage and slash irritability. So that's another thing as well too, because a lot of people tend to forget that irritability is also a sign of depression too. And as a new mom, you might be experiencing increased levels of that, and which then can feel obviously directed towards the baby, or perhaps even the people around you. So I worked with a client once that realized that her irritability slash rage increased after her daughter was born. And it was more geared towards her husband, actually. And then as her baby got older, it kind of shifted towards the baby. And I think as the baby got older, it was because now the baby was able to do more things that could possibly trigger an episode. So maybe crying a lot more, or, as they start to get into things more, right? They're climbing more, pooling, all of that. And then you get into like the terrible twos, as they call it, right? And then there's the not listening and all of that kind of stuff. So we had worked through that together because, one, to explore why her partner, right? What was it? And she also had discussed about how she didn't trust even her partner to be with her baby. And that's where the anxiety comes in as well, like I had mentioned before. So that's just to say is that everyone looks different. Everyone presents differently when it comes to peripartum depression. Now, I'm sure people have also heard about baby blues, And there is a really big difference between baby blues and this kind of depression. So, up to 70% of mothers will experience baby blues. And the difference between the postpartum and baby blues is that baby blues is a short lasting condition that does not interfere with daily activities and also does not require or may not require medical attention like peripartum depression does, right? Like I've said before, or maybe I haven't, in order to be diagnosed with something, the most important thing to look out for in me as a clinician who does diagnose people with certain conditions and disorders is that how is this affecting your daily functioning, right? So that term that a lot of people will use, like, oh, I have such OCD, or I have ADHD, PTSD, all those things that are thrown around and stuff. And I've even had clients that will come in and they are convinced that they have this one thing. And one of the questions I'll ask is, how does it interrupt your daily functioning? How is it interrupting your daily routine? Is it that bad that you are not able to function? Right? So if a person has anxiety and they want to be diagnosed with a specific condition or disorder on it, how does it affect you daily? Let's talk about it. Let's explore it. So that's with the baby blues. It won't interfere with the daily activities, right? So some of the symptoms of baby blues include crying spells, which basically means bouts of crying, irritability, restlessness, and anxiety. And now these will usually last 1 to 2 weeks, and then it kind of simmers off. And then that's something to look out for. If you feel like, hey, am I experiencing peripartum depression or anxiety? Look out of the duration of it. How long is it lasting, and how intense is it lasting for you? How intense the symptoms are for you as well. And so the baby blues also usually resolves without any kind of treatment. So that's something to remember as well. Now let's look into the symptoms of peripartum depression. So a few are feeling sad or depressed, right? Obviously. Loss of interest or pleasure in activities. And this is important because it's loss of interest / pleasure that you might have had in activities prior. So let's say that prior to childbirth, you were really interested in knitting. It's the first thing that came to mind. You know, something that you really like to do, you would do it every other day, or maybe it was drawing. Another example. Now, after this, you're noticing, and not because you're too busy with the baby, right? Because that's something to remember, of course. I mean, I can't even imagine having a newborn and a baby and having to take care of it. But it's still like realizing like you just don't have the motivation or the drive to do these activities that you enjoyed before. Another symptom is loss of energy. Thoughts of death or suicide is also another symptom. And the ones relating to the baby is lack of interest in the baby, not feeling bonded to your new baby, or feeling, like I mentioned before, very anxious around or about the baby. Another symptom might be feelings of being a bad mother and fear of harming the baby or oneself. Now, there is, speaking of harming the baby, now there is a psychosis that does relate to peripartum depression. And that's a whole other thing that we're not going to get into today. But there is this part of postpartum depression that does involve psychosis. And I think many people, of course, like a lot of other things with mental health, they think that's what a lot of it, people get very scared about that. They're like, you know, if you say that you have postpartum depression, people automatically think about those cases of the mothers who drown their babies and everything. And that's just an extreme, severe case of peripartum / postpartum depression. But there is a psychosis that can come with it. And that's why it's important to look out for these symptoms and everything. So a woman experiencing peripartum usually has several of these symptoms that I mentioned, and their severity may change over time, of course. So those are just a few symptoms that I decided to write down for today's episode. There can definitely be a lot more, but those are just kind of like the basics of it. And I don't know if I'm correct in this, and I don't know, and I probably should have researched it before I started today's episode, but I'm almost positive that the hospitals that you decide to have your baby at will assess you for postpartum in the hospital right after childbirth. And I'm pretty sure it's a very basic questionnaire of how you're feeling, what you're thinking. And then I guess if you probably trigger on the assessment, they might give you some resources and recommend that you speak to someone. I think that's as basic as it gets. I could be wrong on that, but I'm pretty sure that's what I've heard prior. I think that's kind of like the bulk of it in a sense. And I think it's good that they probably have been trying to be more aware about it, but you start to think like, hey, if somebody does trigger on that, shouldn't there be immediate help in that sense, right? Instead of just maybe referring them to someone and kind of hope for the best. But maybe they do. Maybe some hospitals do provide that immediately, but I don't really know about that. So to be diagnosed with peripartum depression, symptoms must begin during pregnancy or within 4 weeks following delivery. While there is no specific diagnostic criteria or test for peripartum depression, it is still a real illness and it should be taken seriously. So I've mentioned the word major depressive episode, and there is a specific disorder called major depressive disorder, MDD. And this disorder is the criteria is that you've had to have had at least 5 out of the 10 symptoms within the last 2 weeks. And within that diagnostic criteria in the DSM-5, there is a lot of specifiers, is what we call it. And the specifiers can go anywhere from psychotic features, seasonal pattern, aka is what people know as seasonal depression. There is no seasonal depression anymore. It's now just a specifier within the depressive disorder. And then there's a couple of others that I don't necessarily know off the top of my head, but one of them is the peripartum onset is what they put in. So there is no specific criteria or disorder of postpartum / peripartum depression, but it is within the major depressive disorder diagnosis. I know that was a lot, but that's how it goes. So that's how a person can be diagnosed with it officially, I mean. Okay, so now who is at risk? So to be quite honest, any new mother can experience symptoms of this. It does not discriminate. Of course, women are at increased risk of depression during or after pregnancy if they have a history of depression or other mood disorders, if they are experiencing particularly stressful life events in addition to the pregnancy, or if they do not have a good support system. So those are, of course, the higher risks, but in reality, anyone can experience it. And I think it usually comes as a surprise to some people if they've never had a history of mental health issues or symptoms. So, of course, if you are having that before childbirth, then you are at higher risk in terms of depression or anxiety. So with that being said, right, if you do know that you have a history of depression or perhaps a history within your family, right, maybe ask even your mom, hey, how did you feel after you gave birth? Did you experience depression? Did you experience anxiety? And so, of course, that could also play a role in how you will be as a new mother. Of course, it's not an end-all be-all. I don't want you to think that if you go and ask your mother if they experienced depression or anxiety that you're automatically going to feel that too. But it's just good to know that because this is the way that we prevent things from happening, the same way that we discussed suicide last episode. Prevention is key. And sometimes these things can come up and they're not sometimes preventable, right? Especially with all the things that come with being a new mom and or just a mother in general. Maybe it's not being a new mom, because I know that some mothers will experience depression or anxiety for one child but not the other. But there's a lot of different things that are going on, right? So it's important just to at least have some knowledge and some education on it so that maybe you can help yourself if that time comes. Okay, so some treatments for peripartum / postpartum depression is talk therapy. So you can see a therapist and discuss your symptoms, the issues with it, and hopefully they'll be able to provide you with some treatment tools or some coping mechanisms. That way you can hopefully manage it a little bit better and not feel like you're alone in that too. Another way that could help with treating this depression is a supportive environment. So perhaps you may want to reach out to a mom group or look for local groups that might have mothers who experience this, right? It always feels great when you know that, hey, it's not just me going through this. There are also other people who might be going through this, and we can all talk about it. We can all discuss it and find ways to help each other. There is also medications, right? Of course, always discuss with your doctor before you're considering anything of this, because there are risks to, of course, taking medications during pregnancy. There are, of course, tiers to it. I have to think about my psychopharmacology class in grad school. But I believe it's A, B, C, D, and E, and each one has a category. So each psychiatric medication will go under that specific tier. And if, hey, this one medication, if it's on tier E, for example, it's high risk, don't even think about taking it during pregnancy. And then, but it could be just A, B, and C, and D. I don't remember. But either way, if you are experiencing depression or anxiety while you are pregnant, it's obviously make sure that you do speak to a doctor about it and reach out to someone that might be able to help with that. Okay. So I think a lot of times as well, it's just understanding that this is not a disorder that is one person. And what I mean by that is that it's important to reach out for help when you feel like you may need it. And this is such a prevalent disorder and issue. And I think, like I said before, I think a lot of us are talking more about it. And I think the research is there more. But try your very best to gain that support if you can, And if you do have a partner that you are doing this with, see how your partner will be able to help you if that, and I know that it kind of feels like you are alone as a woman, maybe having a baby, and maybe the person that you're having it with is not understanding of that. It's just always good to try to reach out for help as much as possible. And there's no shame in it. I think that's what I'm trying to get at. There's absolutely no shame in asking for help. And even though it might feel that way, there is no shame in it at all. Okay. So I hope that this episode was good for everyone in terms of educating themselves. And if there are any new mommies out there, I hope all of that goes well and everything too. All right. So for today's affirmation, it's going to be, I allow myself to accept love and help. Okay? Because if you don't allow anyone to come in, how can you receive that help? Even though I know it's, pretty nerve-wracking and everything sometimes to ask for it. All right. So I hope everyone is well, and crossing fingers, next episode, Joe will be back with us. But other than that, I hope everyone has a great week, and we'll see you for next episode. Thank you.